Welcome to What's New with AvaSure. This is our quarterly update where we share the latest enhancements to our virtual care platform and spotlight new ways we are supporting our customers. We're glad you're with us and excited to show you what's new. My name is Jenny Hilton. I'm a product marketing manager here at AvaSure, and I'll be your host today. Joining me will be Brian McKinney. Brian is a customer success manager for strategic accounts across the Northeast and Central regions. Also with us is Brad Smith. Brad is the Principal Product Manager for AI and Interoperability here at AvaSure. Today, I'm going to give you a recap of recent industry events, highlight some collaborations, and announce a new product. Brian is going to walk us through how virtual nursing can be scaled for success, and Brad will talk with us about how we're seeing the perception of AI really make a shift. And then we'll take some questions. You can submit those throughout the webinar by clicking on the question icon at the top of your screen. All right, but first I'd like to tell you a bit about what we've been up to. We recently wrapped up two of our biggest events of the year, HIMSS and AONL. It was great to see our customers in person and show them what we've been up to. Smart room strategies, Epic integration, and how clinically led AI can make a real difference in workflows and patient safety. What we're consistently seeing is that health systems want a smart platform they can build on. And we're excited to show how AvaSure can be that partner. The highlight from AONL was hearing directly from three customers at a sunrise session: Hackensack Meridian Health, Peterson Health, and LA General. They shared real results from their virtual care programs: reduced ED hold times, faster discharge turnaround, fewer travel nurse hours, and lower RN turnover. Compelling outcomes and a great reminder of why this work matters. At the beginning of the year, we announced that we are expanding our partnership with Equim Medical. Equim brings physician-led virtual care, think tele-ICU, virtual hospitalists, and specialty consults across neurology, psychology, cardiology, and more, all running on the same AvaSure platform the hospitals are already using for their virtual nursing and patient observation. No new tech stack, no new vendor to manage. For health systems, this is really about keeping higher acuity patients local. Fewer transfers mean protected revenue, better continuity of care, and more efficient use of clinical resources across the board. We're linking the press release in the chat if you want to dig in. But now we'd like to introduce the Dual Flex Cart, enabling virtual care in even more locations and clinical workflows. This mobile option of our popular Guardian Dual Flex device comes with some great features. It has a dual camera system with a 30 times optical pan tilt zoom camera for clinical use, and a second fixed lens camera to support AI workflows. It also has incredible battery features. The battery will hold a charge for 8+ hours, and it's hot swappable, meaning the base station maintains connection while you swap out batteries without losing your session. And there are many more features. It has a tray, it has a basket, multiple microphones, as well as great audio and rich connectivity. We're excited to announce this release and provide a bit more flexibility to your virtual care environment. So be on the lookout for more information. It will be available this spring. And now I'd like to spend a few minutes on how AvaSure integrates with Epic, and more importantly, what that means for you and your teams. Epic is core to our strategy because it is where clinicians already live. If virtual care isn't embedded there, it doesn't scale. We're an active member of Open at Epic, and we've achieved Toolbox designation for inpatient virtual care. So what we build aligns with Epic's standards and workflows. We embed virtual care directly into Epic. Clinicians can launch virtual visits from hyperspace, no extra apps or logins. We support continuous observation in Epic Monitor for safety workflows like falls, and through MyChart Bedside TV, patients can connect with care teams right from their room. Behind the scenes, HL7 integrations keep everything in sync, automating patient context and reducing manual work. When you put it all together, it drives three things: adoption, because it fits into existing workflows; efficiency, because it removes friction and duplication; and scalability, because it creates a foundation that can expand across the enterprise. That's really the goal: moving from isolated installs to something that scales and delivers real impact. Now, I'll hand it over to Brian.
Thanks, Jenny. Hi, everyone. Thank you for joining today. I will be providing a quick overview of the recently published white paper, How to Scale Virtual Nursing Beyond Pilots by Hackensack Meridian Health. My name is Brian McKinney, and it is my privilege of being the Customer Success Manager for Hackensack Meridian Health Network, New Jersey's largest and most comprehensive not-for-profit healthcare, consisting of 18 hospitals and over 500 patient care sites. A quick bit of background, Hackensack actually began their virtual nursing journey all the way back in 2022 with a rolling deployment across 4 sites. And what they have learned, I'm sharing today. The key takeaway was simple. Virtual nursing is no longer experimental, it's becoming essential, but most hospitals are still stuck in pilot mode. So let's start where things are today. A 2024 study shows that a strong majority of hospital leaders, nearly 75%, believe that virtual nursing will become a core part of inpatient care. However, there's a big gap between belief and execution. Only about 10% of those hospitals have a fully standardized virtual care platform today, and nearly 30% have no virtual care workflows at all. So the challenge that we're running into isn't whether virtual nursing works, but how to scale it successfully. And to answer this, 3 key barriers were identified as major obstacles to keep organizations stuck in that pilot phase. Lack of organizational alignment, staffing complexity, and third, sometimes the most obvious, is funding and infrastructure challenges. So let's address those barriers right now with lesson 1, cross-functional alignment. Scaling virtual nursing starts with alignment across the entire organization. This isn't just some technology rollout, it's a change in care delivery, workflows, and ultimately culture. And in order to create that successful system, to start, you really need to engage your frontline nurses early, often, while also emphasizing that virtual nursing enhances, not replaces, bedside care, while also building a structured team across the entire department. A strong example of how Hackensack Meridian accomplished this was by dedicating 5 teams to these tasks: tech and infrastructure, clinical workflows, nursing operations, education, and communication. This ensures that everyone from leadership to bedside staff is aligned and invested. With the key point, and let's really hammer this home, if nurses don't buy in, the program's not going to scale. With that being said, the results of scaling effectively indicates real impact from that virtual nursing initiative. We can see this in the reduction of documentation time, lower nurse overtime and traveler usage, and even shorter patient length of stay. Most importantly, bedside nurses can now focus on direct patient care instead of administrative tasks, such as documentation. Lesson 2, strategic staffing. And what does that mean? Instead of just filling shifts, organizations need data-driven staffing models. And upon learning about that, you actually find that you need to staff to demand, not around the clock. Some of those key insights that Hackensack discovered were the fact that admission peak is in the afternoon and evening, while discharges happen mostly during the day. So overall, the demand for virtual nursing is highest from noon to 9 p.m. This means that staffing should then be aligned to demand, not evenly distributed. Another important metric to call out, virtual nurses spend about 20 minutes per bed per day. What this allows is to help determine appropriate nurse to patient ratios. Strategic staffing, lesson 2, part 2. Flexible staffing approaches. Organizations have 2 main options to accomplish virtual nursing. You can leverage your internal staff today, or you can partner with external providers. Both options can work, but flexibility really is key. And this leads to some important considerations to think about. 1, the experience level of your current nursing staff. Mainly, you really want to You really want to avoid pulling your most skilled bedside nurses away in order just in case if it creates any gaps in care. Also, need to maintain consistent job roles to allow for that flexibility. Because at the end of the day, trust takes time, whether your staff is internal or outsourced. Lesson 3, funding and infrastructure. As identified earlier, funding is often the biggest concern. However, to address this concern, let's talk about 2 practical strategies. Use of labor savings to fund the program. For example, you can actually use virtual sitting to replace up to 70% of in-person sitters today. Thus, those savings can then help fund your virtual nursing expansion. Or you can also look at distributing costs across departments. So instead of one centralized budget, you can then spread small costs across units. Once you've identified the strategies for funding, let's lay that foundation and ask, what's required on the technology side? Hackensack found that scaling requires permanent room setups with fixed devices, not mobile carts, along with integrating into existing tools such as like EHR systems. In addition, training and support are critical for long-term success. So you've secured the funding, you've laid the foundation for technology needs, but how should you approach deployment? Flexibility. That word keeps coming up, and for good reason. Organizations don't need an all or nothing approach. You can start with a specific use case for those high impact areas. You can utilize external partners to fill the gaps in technology and staffing, and then gradually start to scale while maintaining quality. This flexibility allows for faster implementation without overwhelming the internal teams. And as we look beyond the metrics, one of the most powerful outcomes is restoring purpose for nurses. With virtual support, nurses can have more time with patients so they can focus on meaningful care instead of repetitive tasks. What ultimately can result in job satisfaction and retention improvement. The human element is just as important as the financial ROI. And to wrap things up, scaling virtual nursing requires more than technology. It depends on strong organizational alignment, smart, data-driven staffing, along with sustainable funding and infrastructure demands. When done right, virtual nursing creates a more efficient system and a more patient experience. So in short, the question should no longer be, should we adopt virtual nursing? It's how do we scale it successfully? Thank you. And here are some resources in chat to understand a bit more about scaling virtual nursing successfully. And now I will hand things off to Brad Smith to answer what's new with AvaSure and AI.
All right, so I want to spend a couple minutes on what's new, and honestly, this is one of the most exciting updates we've had in a while. We've got some exciting feedback we've been hearing from folks using our AI solution, and I wanted to share a few examples. So one, we're seeing teams intervening earlier because of the alerts. We're hearing that our AI is just working. I mean, imagine that, AI just works. And maybe my favorite, it's people saying that, I can't believe that's possible. That's usually when you know you're onto something. And then honestly, there's my most favorite feedback of all, it's my mom. So you know you really made it when your mom's making good feedback like that. But all jokes aside, this really represents a shift. We're moving from reactive monitoring to proactive awareness. Instead of waiting for something to happen, we're using AI to starting to identify risk earlier and give staff just enough signal to act. And most importantly, this isn't replacing staff. It's making the people you already have more effective, helping them cover more ground with more confidence. And if you're curious on how all of this works under the hood, we're taking it to the next level. We've got a couple of blog posts that go a little bit deeper. I invite you all to take a look at them. But the headline is simple. AI is becoming part of day-to-day workflows, and it's delivering results. So building on that momentum, this is really where things start coming together. At a high level, AvaSure has never been smarter, and most importantly, more connected to what's actually happening in the room. And at the center of it is our virtual care assistant, Vicky, which you may, if you've seen the webinar from last quarter, you may remember her dancing around. Well, this is really about what Vicky and all of AvaSure is about improving the patient experience. We want to give patients a simple, direct way to communicate what they need and making sure those needs are actually getting routed to the right place. But what's really powerful is everything else that's happening around that. You've got our ambient AI that's continuously observing the environment, not really in a disruptive way either, but in a way that understands context. So now we're not just reacting to button presses, we're picking up on things like patient movements, falls risk, whether PPE is being used, and even operational signals like meal delivery or staff rounding. All of that is AI that feeds into both clinical and operational workflows. So instead of siloed systems where you have nurse call over here, bed management over there, documentation somewhere else, we're starting to unify that single layer of awareness. And that's where the platform piece becomes really important, because we're not trying to do everything ourselves. We're creating an open platform that integrates into the broader ecosystem. As you heard before, we have really good partnerships with Epic and EMR systems. We're integrating with nurse call systems. We've got digital signage. A lot of this is things that the hospital may already have in place or are planning to implement. We're there. When we talk about the eyes and ears in the room, this isn't really just about monitoring. It's about enabling a smarter room, one that can actually contribute to workflow, surface insights, and ultimately help staff to make better decisions faster. And that's really the shift from the isolated tools to an intelligent, connected care environment.
All right, thank you, Brad. Well, registration is officially open for AvaSure's 2026 Symposium. This event is designed for you, nurse leaders, IT innovators, and operational executives. Come and learn from your peers, share what's working, ask questions, and walk away with clarity, confidence, and a shared purpose. So scan the QR code, register, and join us in Atlanta, September 28th through 30th. In the meantime, AvaSure is looking forward to seeing you at some industry events coming up. Here are a few places we'll be. This month, we'll be at the Chime Informatics Leadership Academy in Irving, Texas, and at Epic XGM in Wisconsin. In May, we'll be at ATA Nexus in Orlando, and in June, at THMA CNIO Forum in Carlsbad. So, if you'd like to stay informed on what's new with AvaSure, click the QR code. Sign up for our monthly newsletter and stay up to date on our webinars. Now we'd like to try and answer any questions you may have, bringing Brad and Brian back into the conversation. Let's see, what do we have? Remember, you can submit a question by clicking on the question icon at the top of your screen. First one, how do I add AI into my workflows? Who wants to take that?
That sounds like a good one for me, Jenny, thanks. And so I recommend reaching out to your customer success manager and having a discovery conversation about how AI can both support and enhance your current program. That way you can knock out both clinical and that technical scope.
Very good. Okay, here's another. What are some of the most difficult blockers AvaSure experienced when bringing in virtual nursing into hospitals, and how did you solve that? Who wants to take that one? Brad?
Let you take it, Brian, on the clinical side, and I'll take it on the technical side. So you go ahead.
Yep, from the clinical side, the biggest blocker usually is nurse buy-in alongside the financial. Educating nurses that this is not taking away from their current workflows, but enhancing their day-to-day operations while also reducing that burden of documentation can really influence that overall development of virtual nursing. Alongside, if you're using a virtual sitter program today, can further financial. We can talk about that financial build to take some of those savings from sitting and apply them to that virtual nursing program.
Then from the technical side, one of the biggest things you'll need is just IT team buy-in. These are devices, they are streaming audio and video on the network. They do connect to your networks. So just making sure the IT team is set up, they're ready to support it. And the best part about it is, they can support it either on AvaSure's cloud, or we also have on-premises servers. So if maybe your IT team is like, as you go into this, the IT team's like, we don't have the resources to handle this. No worries. AvaSure's cloud solution allows AvaSure to handle a lot of the IT load versus having your on-site IT team work through it.
Okay, very good. All right, our next question is on the DualFlex cart. The DualFlex cart is the same cart used for telesitter monitoring. Do we need both?
That's the idea, is that the new Guardian DualFlex mobile cart will be part of the evolution of our mobile platform. The best part about it is it is battery based. It does have multiple use cases tied to it, and virtual sitting and virtual care can all be performed off of that cart.
Very good. Okay, here's another. How does AvaSure support patient mobility and patient bed management and falls? Can you talk in more detail about this? Brad?
Yep. Yeah, I can do that. So a lot of it's through AI. So if you think about it, you have a device in the room that's able to constantly scan and understand the interactions of the environment. So things like patient mobility, that's, it recognizes a patient, recognizes their movement, whether they're sitting, standing, walking around the room. We can monitor and measure mobility using AI. If you think about bed management, we can recognize when the bed's in the room, when the bed's out of the room. We can recognize when cleaning equipment's entered the room. We can really start to understand from a operational flow, hey, this patient's been discharged. We don't see the patient in the room. Now we see the bed leave. Then we see the cleaning equipment come in. Then we see a bed come back into the room. And even in the future, we can see like, hey, that bed looks fairly made up and ready to go. These are all things that allow us to work through bed management just simply using AI. AI is another piece of eyes and ears that allow, it really unlocks a lot of workflows, because you've now got something that understands the environment and what's going on in that clinical, the clinical area.
All right, here's another one. I'm dealing with AI. How does AvaSure AI advance staff rounding?
That's the best one. So there's a couple of things. So with staff rounding, one of the things that we've done is we can recognize staff entering and exiting the room. So what we do is we pick up on subtle cues of what, if you go into a hospital, everyone can look and see, like, that's a nurse, that's not a nurse. Our AI computer vision utilizes that same technology, that same thought process. It understands what nurses wear, how they look, how they interact. There's certain visual cues that indicate that, hey, that's a nurse and not a nurse. And so that's how we're understanding, hey, there's someone who went in the room and someone who's left. But then on top of that, you've just got the overall virtual care workflow. So now you can use virtual care to help augment your staff rounding. And this is really, this is outside of the need for AI. It's using AI to, intelligently understand when rounding needs to occur. Maybe you have rounding that happens and our system detects nurses in the room and out of the room. Now all of a sudden that rounding order might have been cleared by, a physical nurse versus a virtual nurse. It really all comes down into the ability of AI to understand and recognize the environment. And then there's a layer of intent as to, what's the intention of that person or that thing in the room. And that's what makes our AI shine, is we try to take into account not only just someone's there, but also trying to start understanding their intent.
Thank you. All right, we have a couple on Epic, so we'll put them all together. Can you go into more detail about Epic integration? How does AvaSure connect to Epic? Is it through server cluster or instant feed?
Ooh, that's a good question. So I will go and admit server cluster and instant feed are terminology I don't typically use, so I may not use these in this example, but hopefully this will answer the question. So we connect using our, we have kind of a direct connection into Epic using an HL7 integration engine. So Epic, I know a lot of you may use Cloverleaf. If you're familiar with things like Rhapsody, Mirth, or LK, AvaSure actually utilizes LK. So LK is our strategic partner and our partner within our solution. When you purchase AvaSure's integration, AvaSure partners with LK to install LK Opera to be the engine that connects to the EHR. So really what happens is Epic sends an HL7 message out of the system using Cloverleaf over to LK. LK then takes it, translates it, and converts it into the appropriate message that AvaSure wants to see. So LK is really that, centralized integration engine that what really, it really becomes more of an instant feed type piece where when an event happens, we're receiving it. Things like admission, discharge, transfers, all of those are events that happen. They get sent over to LK. LK then sends them to us. But when you think about LK is, it is AvaSure. LK is just the solution we use, just like, there's other companies out there like Rhapsody, Mirth, that your hospital may currently have as well, or you may already have an LK connection to LK installed for other EMR connection points.
Thanks, Brad. I think we have answered all the questions. If more come up to you later that you want to reach out, you can always go through your customer success representative and we'll get back with you.
I don't know, Jenny, there's one just came in.
Oh, okay.
Pineapple on pizza, yes or no?
I'm a yes, but
You're
I
a
have
yes.
to
So
balance
2
it
yeses.
with something spicy, but that's me.
Yeah, I'm a yes. I know it's kind of, I don't mean to offend others. It's just there's a time and a place, and maybe sometimes you want pineapple, maybe sometimes you don't. It's not, I'm not trying to
No judgment. Yes.
no judgment. Yeah, no judgment.
Always pineapple.
Thank you all for joining us. If you missed any part of this webinar, it will be available on demand on AvaSure's website and sent to you via email since you registered. We look forward to seeing you next time. Thank you.
Thanks, everyone.